guys, welcome back to the D&N Medical Series. In today's video, I'll be talking about gestational diabetes or diabetes in pregnancy. So what is gestational diabetes? So gestational diabetes is basically having high blood sugar levels or high blood glucose, as we may call it, during pregnancy. So before, your blood glucose will be normal, you're not diabetic, but during pregnancy, your blood glucose level will rise above normal, usually diagnosed about 24 to 28 weeks. And when you deliver your baby, your glucose level goes back to normal about after 6 weeks. So essentially, you'll have diabetes during pregnancy. However, you don't have diabetes after the pregnancy or before the pregnancy. Now, why is this important? Now, people who develop gestational diabetes will have a 50% risk of developing type 2 diabetes in 25 years. So because a lot of people, when they have gestational diabetes, they don't have any symptoms during pregnancy, it is important for us to screen them. So a screening tool is called O'Sullivan's test. And for the O'Sullivan's test, what you do is you drink 50 grams of glucose and we measure your blood glucose levels after 1 hour to see if it's normal. So this is just a screening tool. So if it's abnormal, like your levels are high, it doesn't mean that you have gestational diabetes. You'll have to do what we call an oral glucose tolerance test or OGTT test, where you'll have to fast 8 to 12 hours. You drink 75 grams of glucose and then we measure your blood at fasting 1 hour and 2 hours to see if it's abnormal. Once this comes back abnormal, then you have gestational diabetes. So after diagnosed with gestational diabetes, it's important to keep your blood sugars low to prevent certain complications that you can get with gestational diabetes. So your doctor may give you insulin twice per day for this. All right. So what are some complications of gestational diabetes? The most famous one is macrosomia, in which your baby becomes bigger than normal. So over 8 pounds, 13 ounces is called macrosomia. There are other complications. The baby can get hypoglycemic after birth, and so they need monitoring by the pediatrician and they may be admitted. They're also at risk for preterm delivery because mothers with diabetes are at increased risk of infection. That could be one of the reasons for preterm delivery. Usually, persons with diabetes are at risk of having babies born dead, called stillbirth. So what they do is that they usually induce labor about the 38 weeks, so you don't go up to 40 weeks, because they notice that delivering at 38 weeks will improve the chance of your baby surviving. All right, so they may have to do that. Also, because of the fact that the baby is bigger than normal and the shoulders will be bigger than normal, sometimes vaginal delivery may not be possible. So sometimes you will get a C-section. All right, that's it for this video. See you in the next one. Goodbye.